One of the important decisions parents have to make is picking out a pediatrician.
It can be stressful. It's the person you're going to rely on to keep your kids healthy and maybe more important, to help you answer all of the questions you have about parenting issues. So here with advice on picking out the right doctor is our own mid-morning pediatrician, Dr. Gigi Chawla from Children's Minnesota. We're glad we picked you, Dr. Gigi.
Oh,
we feel like that worked out very well.
Is that what this segment is about? Is really just call doctor?
Oh.
That's right.
Always willing to help.
There are a lot of things that people should think about, and the time you start thinking about pediatrician might be earlier than parents think, right?
Right, absolutely. We don't want parents to be trying to choose their pediatrician after they've already given birth. Really, spend some time
while
to
you're
think about
pregnant.
it.
It's go time to think about it.
Great time during your pregnancy.
So what are some of the things that you should be considering? Because I imagine that it could be, is it like Yelp? You just you go and look for a doctor, you Google it and see what people say?
I think people use lots of different techniques. They use their friends and resources. They use the internet to try to find out things like, who has the best ratings.
Sure.
But also, we'd really love to make sure that you're thinking about quality and safety and looking at our scores in that realm too.
Yeah, it's not just whether your friends
word of
like
mouth.
them or not.
Yeah.
The key for most people is finding out who their insurance will allow them to
Absolutely.
go see. That's usually
Definitely
where it starts.
start with that.
But after that, you start maybe asking questions even of the provider or of the clinic that you're thinking of.
Exactly, and it's a good idea to interview, even while you're pregnant, trying to sort out what types of person that you're looking for. When you have a newborn and you're a new parent, you're really looking as a parent for someone that you can relate to, somebody that's going to be okay with the questions that you ask. When you have a child who really needs to establish their relationship with the clinician, it's a very different thing that you're looking for, somebody who can relate to your child. And then when you're looking as an adolescent, it's really not about parents at all. It's about what the relationship can be like between that adolescent and the clinician.
That relationship is so important, but that can also make it difficult if maybe concerns come up. If there are some issues, do you have any recommendations on the best way to handle anything that might come up?
Yeah, I think it really, with honesty is the best policy with that. So finding somebody all along that you feel like is going to speak the truth and relate to you in a way that resonates. Certainly every practice has got clinicians that specialize or focus in different areas, like adolescent care,
Sure.
for example.
Do people sometimes oversimplify this, where maybe if you're a younger couple, you want a young pediatrician, maybe you want a female, or those are often things that parents are considering, right?
Those are really important strategies too. Certainly if you want to stick with the same pediatrician throughout a child's lifetime, you want to start with somebody young who's going to be there the whole time.
Sure.
And you'll find also that as kids get older, sometimes they want a male physician, sometimes they want a female, and that can change, and that's okay too.
So that's okay then to change physicians?
Yeah, we want families to feel comfortable with changing to make sure it resonates with the child and it resonates with them. Of course, if you could stay with one pediatrician who could fit all of those categories throughout a child's life, that would be magical.
Really great. Great advice. Thanks, doctor.
Thank you.